Okay, the first thing I'm going to do is check my medication using the 5 rights of medication. I'm going to make sure I have the right medication, and I'm going to verify my patient, the right dose, the right route, and then the right time. Then I'm going to select my tubing. I'm going to use my primary tubing. Go ahead and hang this. And the first thing I'm going to do when I open my tubing is make sure that I have the clamp all the way. Clamp down. And then I am going to remove the tubing port and also the cap to this, which it is sterile. And I'm going to go ahead and spike it, making sure not to touch the tip. Alright, and I'm going to squeeze this to get some water, fill it up about halfway. Alright, and then I am going to slowly release on the clamp so I can prime my tubing. To clamp down on my port. I'm going to hang this up. Okay. Now I'm going to enter my patient's room. Hi, my name is Kate. I'm going to be your nurse today. Sorry. Hi, my name is Kate. I'm going to be your nurse today. Could you please verify your name and date of birth for me? Alright, today I'm going to be inserting an IV. Do you have any preferences as to where you want your IV? Alright, also, do you have any allergies? Okay, now I'm going to perform hand hygiene and close the curtain for privacy. Now I'm going to gather my material. I'm going to get my, my IV starter kit. I'm going to get my extension set, a syringe, and I'm also going to get a blunt tip needle, and I'm going to select my needle and catheter for the vein that I'm going to use. I'm going to use a 22 gauge by 1 inch, and I'm going to get a pen. Alright, now I'm going to open up I'm going to move these over here. I'm going to open up my starter kit. And get out my supplies. I'm going to go ahead at this time and rip my tape for easy access later on. Alright, and then I am going to get my syringe and my blunt tip needle. prime my extension port. Okay, and then I'm going to set up a little sterile field over here. Place this, and I'm going to go ahead and loosen the cap and place it in there. Okay, now I am ready to select my site. I'm going to do this vein. It is long and it is straight. Then I'm going to get my tourniquet. Okay, and then I'm going to apply my gloves. And I am going to get my needle. Clean my site. I'm going to open my needle and cannula. Alright, so I'm going to go in, bevel up at a 10 to 30 degree angle. Alright, and then I'm going to observe for flashback, and then once I see that flashback, I'm going to advance a little further, and then I am going to advance the catheter while retracting the needle, and I'm also going to occlude the I'm going to occlude it so that the site does not bleed. Then I'm going to attach my extension port, and I'm going to pop my tourniquet. Okay. Now I am going to tape down and secure my thing, and I'm going to take off my gloves. And place it. This is kind of in the way. Alright, and I'm going to date, initial, and time it. And I'm going to dispose of my needle in the sharps container. And actually before I put this tape on, I was going to, I should have primed it before I put the tape in the Tegaderm on. So I'm just going to prime it, okay. And now I am ready to connect my tubing, and I'm going to use an alcohol swab to clean the end of this extension port. I'm going to apply another blunt tip. Alright, and I would also release on the clamp. Okay, so now I'm going to discontinue the fluids by pushing back up on the clamp so no fluid is going. And I am going to remove my tape. And I'm going to get a piece of gauze. And I'm going to put on pair of gloves. Okay, where's my gauze? I'm going to remove all the tape. Some pressure and remove the cannula, and I'm going to note that it is intact.